from the anatomy احنا حقيقة اللي يهمنا بالبورتال hypertension from the medical and surgical point of view and from the point of view of complications اللي هي البورتو systemic or porto cable communications. عندنا 3 major sites، 3 مكانات تهمنا clinically and تهمنا أيضا in case of complications and emergency situations. أهم واحد عندنا اللي هو the lower end of the esophagus, communication between the portal through the left gastric vein and through esophagus vein at the lower part of the esophagus. هذا أهم communication عندنا. There most of the fatal conditions or fatal complication or emergency situation وحتى surgical intervention to prevent the bleeding from the site. Other site were communication through the inferior rectal vein اللي هو systemic and the middle superior and superior rectal vein اللي يسوي لنا أيضا هو يسوي لنا الهيمورويدز or piles اللي يصير عندنا also a complication of portal hypertension. هنا communication through the paraumbilical vein with the systemic veins اللي يسوي لنا هاي physical sign احنا نسميها كابوت مودوسا. To the lower end of the esophagus, umbilicus, and lower end of the rectum. طبعا اكو area هي مو مهمة عندنا clinically. Retroperitoneal communications and the bare area of the liver. Also there is abortosystemic communications. هنا من يصير عندنا portal hypertension نشوف cirrhotic liver. الاريا هنا واضحة بس اللي يهمنا أكثر شيء هو هذا المكان وهذا المكان اللي هو anorectal varices and esophageal varices. طبعا ال bleeding from the anorectal varices تقريبا هو 10 to 30% of cases. But the it is not an emergency. حقيقة هو rarely give rise to an emergency situation. الاسوفاجيال varices التعبير الأصح هو المفروض احنا نقول esophageal stomach or gastric varices. التعبير مرات احنا نقول esophageal varices واحد يعتقد بأنه just in the esophagus هو حقيقة it occurs in the stomach. اديفندس طبعا هو بها كلاسيفيكيشن ممكن احنا نسميها انترا جاستريك فاريسز جريدز بها احنا بعدين احتمال راح نوصل لها ان شاء الله. bleeding from the gastric varices هو حقيقة more life threatening and more difficult to be controlled than esophageal varices. The 4 important effects of portal hypertension أولاً هو اللي حكيناه بالسلايدات السابقة هو development of collateral portosystemic or portocable venous drainage. Splenomegaly as a result of backflow of blood to the and congestion of the spleen, ascites, which occurs in hepatic and post-hepatic portal hypertension only, and also the manifestation of hepatic failure. هاي 4 أشياء مهمة عندنا بالportal hypertension. نفس السلايد السابق تقريبا. portosystemic shunting of blood, increase pressure in the peritoneal capillaries, and splenomegaly. splenomegaly من يصير عندنا splenic vein thrombosis ايضا هو يسبب لنا ايضا portal hypertension, ascites. ascites, there are other causes rather than portal hypertension that causes ascites. In general, the causes of ascites are liver failure and portal hypertension. Other causes included malignancies, when there is involvement of the peritoneal cavity and seeding of the tumor in the peritoneum, obstruction of lymphatic drainage, like طبعا pancreatic tumor, colonic tumors, ovarian tumors, and so on. Heart failure also producing ascites, renal failure, chronic peritonitis like tuberculosis, and pancreatitis. In cases of portal hypertension, causes in portal hypertension ليش يصير عندنا ascites؟ يصير عندنا because of hypoproteinemia. ليش؟ لأنه الليفر هو the site of production of albumin protein. as a result of hypoproteinemia يصير عندنا ascites. Increasing of hydrostatic pressure and decreasing colloidal osmotic pressure with lymphatic blockage and alteration in aldosterone mechanism through the effect on the kidneys. What are the effects of liver failure? احنا عندنا general effect of liver failure and the effect of portal hypertension. هذا السلايد يوضح لنا الساين والsymptoms of liver disease. In general, the patient is complaining of weakness, tiredness, and malaise. Anorexia, mean losing appetite. Weight loss, which is a common in case of acute and chronic. In cases of acute and chronic liver disease, هم عادة دول يجون anorexia أو patient presented by sudden, massive upper GIT or lower GIT bleeding. ممكن يجينا jaundice with dark urine. هاي طبعا effect of liver failure. طبعا هنا احنا مقسمها تقريبا effect due to portal hypertension على هذا السايت والeffect due to liver cell failure. Presence of spider angioma or spider nevi. طبعا most of these spider nevi occur in the upper part of the body, بالneck, upper extremity, over the thorax. This due to يعني estrogen hormone level increase. طبعا as a result of that طبعا دول يصير عندهم خاصة يعني يصير عندهم in male testicular atrophy. Presence of gynecomastia also. Ascites. Flapping tremor اللي احنا نسميه asterixis, flapping tremor or liver flap. Palmar erythema. Palmar erythema due to hyperdynamic circulation. Muscle wasting, muscle cramps, spontaneous bleeding and ooze. and edema all over. هاي in general sign and symptoms of portal hypertension or liver failure. Effect due to portal hypertension per se هو esophageal varices with gastropathy producing hematemesis, melena. Effect due to splenomegaly. طبعا splenomegaly and its complication اللي يسبب لنا ايضا انيميا, ليوكوبينيا, ثرومبوسايتوبينيا او نجمعها كلها تصير بانسايتوبينيا. clinical feature اللي حكيناها to the surgeon portal hypertension present as three problems. يعني احنا بنشوف او يجينا كيس portal hypertension نخليه as a differential diagnosis of jaundice or hepatomegaly. يعني اذا جانا مريض jaundice or hepatomegaly نخلي in differential diagnosis هو portal hypertension. ايضا هو مهم انه because of gastrointestinal hemorrhage, مهم انه ايضا يعني الجراحين, ومهم ايضا ل gastroenterologist, and also it is a one cause of ascites. يعني one of the causes of ascites, يعني in differential diagnosis of ascites. Presentation. The patient either presented by acutely as esophageal varices or حقيقة احنا during the workup of patient with liver failure or liver cirrhosis احنا نسوي لهم عادة نسوي لهم OGD. اما هاي OGD discovered before bleeding او يجينا patient with يعني shock, يعني anemia or shock as a result of losing blood. Triad of portal hypertension اللي تشمل esophageal varices. هاي triad of portal hypertension تشمل لنا esophageal varices, splenomegaly and ascites. طبعا هو الحكي تقريبا هو دا يتكرر هسه. jaundice feature of encephalopathy, recurrent infection, coagulopathy, hepatorenal syndrome. Okay. هاي نفس السلايد السابق. How do you investigate patient with suspected portal hypertension? First, عندنا liver function test. Liver function test. The degree of jaundice is an important prognostic indicator in cirrhosis. Liver function, we measure the liver synthetic function test, like طبعا الليفر هو السايت of production of albumin. دول عادة يصير عندهم low albumin اللي هي hypoalbuminemia اللي يسبب لنا أيضا ascites, and prothrombin also produced by the liver. راح نقيس احنا ال INR نشوفه دول عندهم هاي. other investigation احنا نسميه tumor marker alpha fetoprotein and other relevant markers, لأنه one of the causes of يعني portal hypertension هو extension or multiple tumors in the liver. Also ultrasound imaging, كلها تشمل هاي imaging technique الالتراساوند, which can assess the liver lesions and liver طينا فكرة على liver texture and also presence of splenomegaly, presence of ascites or presence of intra-abdominal varices. بالإضافة إلى السي تي سكان ممكن contrast CT or MRI من ضمن الايميجينج، والمهم عندنا ايضا مثل ما قلت لكم هو الفايبر اوبتيك اندوسكوبي which could demonstrate the presence of varices and to differentiate between the causes of upper GIT bleeding. طبعا هو مو كل واحد مثلا عنده خلينا نقول liver failure or liver cirrhosis or portal hypertension bleeding from the esophageal varices. قد يكون bleeding from other source like peptic ulceration. Liver biopsy to determine the cause of cirrhosis. Okay. And acetic tab when we take a sample of acetic fluid and other inferior vena cava cablegram. Management of portal hypertension. طبعا management عندنا صورة عامة emergency in the emergency situation and in more خلينا نقول elective or in more stable patient. First of all, general measures. يعني خلينا نقول patient اجانا with esophageal varices bleeding أو اجانا with shock. شنو ال steps to manage such a patient؟ احنا بالإمرجنسي انتم ان شاء الله يعني خلال السنوات القادمة تصيرون يعني بالطوارئ او بالإمرجنسي ديبارتمنت. دائما احنا نقول we have to look for vital signs. The airway كلش مهم عندنا بالإمرجنسي. Look for circulation, bleeding and breaks يعني قسم يسموها ABC. In the emergency department إذا جاك المريض احنا دائما انا احكيها واقول we have to take rapid history from the patient خاصة بالemergency department. مرات انتم حتى ما عندكم وقت تاخذون history from the patient. Just when you look to the patient, sometimes you could find a source of this emergency state. يعني قد يكون مثلا bullet injury أو قد يكون bleeding أو مثلا يجيك المريض أصلا هو stand still. You have to carry on with your resuscitation. دائما إحنا نحاول ناخذ focus history. نقول إحنا الهيستوري بالemergency department either it is a focus history. بعدين المريض ما يكون stable you could obtain comprehensive history, either a focus history or comprehensive history. الفوكس history تاخذ مثلا يجي البيشنت تاخذ منه اذا هو conscious تاخذ منه الهيستوري باس هيستوري من عنده او تاخذ from the relative اذا البيشنت يكون unconscious. Once the patient stable او تنقله الى ردها you could take a full history from the patient. مثل ما قلنا general measures دائما تحاولون to secure his airway. Then you should put طبعا oxygen ايضا رأسا تخلي له mask of oxygen and you have to secure intravenous line. تحاول you find site for two or access to his venous system through two large bore cannulas and instruction to nothing by mouth to the patient, and volume replacement usually by blood. نحاول بالبدايه طبعا اذا ما عندنا blood نخلي له هذا الرينجر لاكتيت or normal saline to alleviate his pressure, and then once cross match available or blood available, we have to give him packed red cells, and then once stabilized, you have to refer the patient to the endoscopy. Endoscopy at that time will be diagnostic and also for therapy, for immediate therapy. And the specific measures, these include measure to reduce portal pressure. Measures to reduce portal pressure. Where by either by surgery by portosystemic shunting اللي نقسمها إلى selective أو non-selective. tips transjugular intrahepatic portosystemic shunting. طبعا هذا يعني يسوي جماعة interventional radiology. and by drugs to reduce the portal pressure like propranolol, nadolol. طبعا هاي كلها beta blocker, non-selective beta blockers. and azosorbide 5 mononitrate. and the last option هو liver transplantation. This is a picture obtained from gastroscopy. It's a big gastroscope. يشوف لنا بالليفت سايد يشوف لنا esophageal varices. طبعا اكو هنا stigmata of bleeding. This is the fundal varices او gastric varices. هذا تشوفون السكوب. احنا طبعا هاي باي ريتروجريد او جاي مانوفر. نشوف الشافت اوف ذا سكوب. This is a cardiac varices يعني stomach varices or gastric varices. Not every bleeding from upper GIT in case of portal hypertension قد يكون from the other source. يعني the differential diagnosis of variceal hemorrhage include acute gastric erosions due to any cause. peptic ulcer اللي احنا اخذناه هي قد تكون duodenal ulcer or gastric ulcer. gastric cancer, Mallory West tear هاي كلها اخذناها. and gastric tube trauma, portal hypertensive gastropathy, portal hypertensive gastropathy يعني involvement of most of the wall or the stomach, and it is a relatively uncommon cause of significant bleeding. هنا types of varices. نقسمها ممكن إلى the type 1 اللي هو طبعا اكو تقريبا 3 types of classification. This classification يقسمناها تقريبا إلى 5 types. Gastroesophageal varices type 1, which is a continuation of esophageal and gastric varices. هو هنسميها type 1 over the lesser curvature of the stomach. هنا over the greater curvature هو أيضا between the fundus or cardia of the stomach over the greater curvature سموها gastroesophageal varices type 2 اللي هي GOV2. هنا intragastric varices اللي it is not in continuation with the esophagus سموها type 1 هنا over the also gastric varices and type 2 هنا over the part of the duodenum يسموها ectopic varices. As we mentioned that the management of hemorrhage from the gastroesophageal varices, the initial important measures اللي حكيناها دائما احنا نقولها you have to look for airway, volume, and electrolyte correction. First of all, if we have no blood, we have to give a crystalloid. مرات نقدر نخلي central venous line through the neck veins or subclavian vein. Sudden overload should be avoided, which may precipitate pulmonary edema, ascites, and hyponatremia. I could have produced pulmonary edema. Sometimes patients require a massive blood transfusion. يعني مرات يحتاجون more than 5 to 15 pints of blood, or even blood products like fresh frozen plasma, platelet, and قد يحتاجون ventilator or in a critical care unit, ICU management. Antibiotics ممكن دول يصير عندهم spontaneous peritonitis as a result of ascites. Vitamin K injection مثل ما قلنا هو liver of the site of production of of clotting substances like prothrombin. We have to calculate urine output. We have to monitor. احنا مثل ما قلنا يصير عندهم دول hepatorenal syndrome, reduction of blood flow to the kidneys, producing renal failure. And we have to prevent encephalopathy, rest of the patient, and we have to avoid sedation, يعني as much as we could, and given as needed with care. عندنا الفارماكولوجيكال يعني هو أول لاين تقريبا in the management after resuscitation. عندنا options اللي احنا like vasopressin. طبعا مشكلته هذا الفازوبريزين الكومبليكيشن مالته يسوي لنا hypertension and vasoconstriction which could affect خاصة patient with يعني liable patient اللي هم with ischemic heart disease, and also it is a contraindicated in those cases. عادة مرات يعني إذا احتاجنا نعطيه nitroglycerin to prevent coronary vasoconstriction and also to reduce the portal pressure. The vasopressin also could lead to fluid retention and hyponatremia. This تقريبا stop bleeding in about 80% of cases. But unfortunately the bleeding will recur. احنا مرات نستخدمه with other measures like balloon tamponade, which increase the efficacy of bleeding control in about 95% of cases. Complication of this treatment هو arrhythmias, myocardial infarction, intestinal ischemia, hyponatremia. So it is a contraindicated in patient اللي هو خلينا نقول patient اللي هم عندهم ischemic heart disease. Librisin أو desmopressin given in IV bolus given, which have longer half-life with a fewer side effects. Somatostatin with a half-life of 2 minutes. which not producing a systemic vasoconstriction like vasopressin, which reduces the splenic and hepatic blood flow. This because of short half-life given in continuous intravenous infusion. Octreotide, which is a synthetic analog of somatostatin. الhalf-life مالته تقريبا 2 hours, which is considered an agent of choice in acute bleeding, which decreases portal pressure and azygous blood flow pressure, which stop تقريبا كل هاي drugs stop variceal bleeding in about 80% of cases. The efficacy of these تقريبا similar to endoscopic sclerotherapy, better than vasopressin, librisin طبعا, in reducing bleeding after endoscopic therapy. The side effect might producing hyperglycemia and طبعا mild hyperglycemia and abdominal cramps. Propranolol who are non-selective beta blockers use in prophylaxis to prevent bleeding. Also other beta blockers like nadolol with longer half-life. We may give Placil or metoclopramide, which in a dose of 20 milligram IV, which lower the esophageal sphincter constriction, and we may also give acid inhibition drugs like يعني PPI proton pump inhibitors. هاي تقريبا كل الدراكس اللي تستخدم. أهم شيء عندنا طبعا من أهم الأشياء that we could control the esophageal or variceal bleeding by endoscopic therapy. The endotherapy either by banding technique, sclerotherapy, gluing يعني نخلي glue, all of these to control the acute bleeding. In emergency to control acute bleeding, also in prophylaxis. The pharmacotherapy is often combined with endotherapy. هنا الصورة دا تشوفون التكنيك of endoscopic banding or esophageal endoscopic variceal banding or endoscopic banding. The endoscopic banding now become the gold standard and ideal for esophageal varices. نستخدم عادة احنا multi shoot banding device يعني at the head of the scope نستخدم device اللي هي تحتوي على multiple bands and we can shoot or ligate the varices. This is ideal مثل ما قلنا for esophageal but not for the stomach or gastric varices because it's because of technical difficulty لأنه محتاجين إن احنا نسوي retroflexion أو احنا نسميها retroflexion or J maneuver. The banded تشوفون هنا بداية الابليكيشن of the band هنا the banded varices. The banded varices will thrombose eventually and then it slough, leaving a small ulcer at the site of sloughing. يعني من يصير بسلاف راح يوفلنا very small ulcer that heal later on. It controls bleeding in about 90% of cases. Considered easy حقيقة technically easy in expert hand بالesophagus, and the chance of rebleeding يكون عندنا أقل هنا. Every procedure طبعا بالجراحة it has its own complication. هنا الcomplication راح يصير عندنا perforation of the esophagus طبعا اللي require surgery, and stricture also is other less complication of this maneuver. Other technique that are used through or by the endoscope هو endoscopic sclerotherapy. Endoscopic sclerotherapy. Also, it is commonly used. Is technically easier and cheaper than the above procedure اللي حكيناها. Both the intravaricial مثل بدنا تشوفوا هنا intravaricial and paravaricial injection are used. أو قد نستخدم فقط الانترافاريسيال injection. اوكي هنايا عادة احنا نبدأ with the paravaricial injection and then we proceed to the intravaricial injection أو فقط ممكن نستخدم intravaricial injection. We should take care that these varices should not be injected blindly. يعني احنا لازم نشوف and we inject the site of varices. There is طبعا this is not free of complication also. With local and systemic complications. Local ممكن أو systemic ممكن يعني إحنا نقول fever. اللوكال أيضا massive bleeding يصير عندنا يعني نحاول we inject بس يصير عندنا massive bleeding or perforation mediastinitis and stricture of esophagus. Other complications like atelectasis, pleural effusion, and so on. Other method هو by gluing يعني application of butyl cyanoacrylate material يعني هاي المادة يعني مثل احنا نسميها موجودة عندنا هاي اللاصق يعني هاي شو يسمونه cyanoacrylate. This hardens in about 20 minutes. We inject it into the varices, which almost control bleeding in about 90% of cases. طبعا هاي المادة طبعا احنا لازم نحافظ على السكوب. طبعا السكوب هو not cheap instrument. طبعا هو very expensive. نحاول when we inject this material to take care of our scope لأنه هذا راح يصير به رأسا المادة يصير بها consolidation and block the channels of our scope. Other method ممكن نستخدم الاندوسكوبيك thrombin or diluted adrenal injection into the varices. But the upper اللي حكيناها the previous methods هو أحسن من الأدرينالين والثرومبين. Sometimes when you are in a center حقيقة احنا الكيسات مرات احنا كنا في سنتر بعيد عن الفاسيليتيز advanced facilities of dealing with these varices. نستخدم يسمونه مينيسوتا tube or Singstaken Blackmore tube. It is a temporary measure to stop esophageal and gastric varices. هذا طبعا متكون من 3 channels تقريبا. Channel for aspiration, gastric aspirate, and channel for inflation of the gastric balloon and for esophageal balloon. احنا ايش راح نسوي؟ طبعا هذا احنا مستخدميه كنا في مستشفيات بعيده في المحافظات، فاجى كيس هو esophageal bleeding or upper GI bleeding. فاستخدمنا هذا التيوب. First we inflate the gastric balloon and we pull it يعني نثبته, and then we inflate esophageal balloon. طبعا البريشر تقريبا 24 ل 45 ملم mercury. نخلي هنا تقريبا 300 cc of air. And as I mentioned, this is a temporary measure to stop bleeding. طبعا تقريبا most of the cases will benefit from this, but you should take care that this maneuver or this tube should be removed in 12 to 24 hours. ليش؟ لأنه راح يسبب لنا مرات necrosis, esophageal necrosis at the site of pressure or pressure necrosis. مثل ما قلت temporary measures إلى حد ما ينقل هذا البيشنت إلى tertiary center to receive the proper treatment for esophageal varices. Rebleeding in this يعني إذا شلنا هذا التيوب من after stopping of or stoppage of hemorrhage, the rebleeding occur in about 60% of cases. Technique of TIPS اللي هي transjugular intrahepatic portosystemic shunting or stenting. This use if all other aerial methods have failed. This commonly controls the uncontrolled acute bleeding, and it prevents further bleeding and considered to be a temporary measure until the patient referred for hepatic transplantation or for hepatic or liver transplantation through the internal jugular vein. طبعا عندي هنا اكو فيلم راح يوضح لكم البروسيجر مال تيبس. خلينا نشوفها. هاي تيبس عندنا هنا. واضحة مو الفيلم واضح؟
واضح دكتور.
هاي بروسيجر اوف طبعا التيبس هو هنا طبعا liver cirrhosis، وهنا increasing of portal pressure. طبعا كل ما يصعد فوق ال 12 تقريبا هو يبدا عندنا bleeding. مرات يوصل into a dangerous level up to 20 to 30 millimeter mercury. نسوي small incision in the neck through the internal jugular vein, and we insert a guide wire and followed by a sheath to the right hepatic vein. Then catheter advance through the hepatic vein, and we measure the by balloon, measuring the pressure in the vein, and then needle thrust through the liver parenchyma to the portal vein, and we do a venogram to ensure that the catheter inside the portal system. Then removing this needle, advancing of the catheter, and measuring of pressure in the portal vein, and then we dilate the area to dilate the tract between the hepatic vein and the portal vein, and then advancing of the sheath, and removing of the sheath, and application of this stent, and open the stent between the hepatic vein and the portal vein. And then we check the pressure. نشوفه راح يهبط عندنا to about 10 millimeter mercury, 5 to 10 millimeter mercury. Okay. هاي procedure of TIPS. طبعا دول يسووها interventional radiology or radiologist. محاضرة الليفر السابقة كنت ناوي أعطيكم إياها، بس أستاذ حميد العرجي راح يكمل لكم إياها. أعتقد لكم إياها دكتور حميد. ألو تسمعوني؟
وياك دكتور الباحة. يوم الأحد أخذنا دكتور حميد محاضرات الليفر.
ممتاز ممتاز. هسه احنا تقريبا بورتال هايبرتنشن هسه اعطيتكم فكره هسه بالوحده. اعتقد راح يدخل الاستاذ رائد عليكم هسه. موجوده كامله على اليوتيوب. اوكي، موجوده كامله على اليوتيوب، ونزل عندكم البي دي اف ايضا تطلعون عليه. شكرا لكم، ولو اخذنا شويه من وقت استاذ رائد. شكرا يعني.